COVID-19 was discovered, there were over 200 million confirmed cases, and the H1N1 virus infected over 4.6 million people worldwide. More than 11,000 people have died as a result of the Ebola virus. Stay tuned as we discuss the stories of these deadly viruses in this video. Welcome to the CHF Information Channel. Before we begin, please remember to like and subscribe if you enjoy our video efforts. Swine influenza, also known as swine flu, also H1N1, is a respiratory disease of humans caused by the type A influenza virus, which regularly causes influenza outbreaks in humans. Human infections with swine flu viruses are uncommon, but they have occurred. Swine flu viruses can cause severe illness but few deaths in animals when compared to humans. Swine influenza viruses can circulate among swine all year, but most outbreaks happen in the late fall and winter months, similar to human outbreaks. This virus was discovered in 1918 throughout the world and claimed the lives of over 13,000 people. According to consistent reports, this virus affected 500 million people worldwide. Swine flu viruses are thought to spread primarily through close contact and possibly through contaminated objects moving between infected and uninfected humans. Infected swine herds, including those immunized against swine flu, may experience sporadic disease or exhibit only mild or no symptoms of infection. Influenza viruses infect the nose, throat, and lungs, causing the flu. These viruses spread when people with the flu cough, sneeze, or talk, releasing virus droplets into the air and potentially into the mouths or noses of those nearby. You can also catch the flu by touching a surface or object contaminated with the flu virus and then touching your own mouth, eyes, or nose. You can spread the flu before you know you're sick, starting one day before symptoms appear and lasting up to 5 to 7 days after becoming ill. Some people, particularly young children and those with compromised immune systems, may be able to infect others for an extended period of time. This virus was discovered in 1918 throughout the world and claimed the lives of over 13,000 people. According to consistent reports, this virus affected 500 million people worldwide. Ebolavirus. Ebolavirus disease, EVD, is a fatal disease with sporadic outbreaks primarily on the African continent. People and non-human primates are the most commonly affected by EVD, such as monkeys, gorillas, and chimpanzees. It is caused by an infection with the following viruses from the genus Ebolavirus. In 1976, the Ebola virus was discovered near the Ebola River in what is now the Democratic Republic of the Congo. Since then, the virus has infected people on a regular basis, causing outbreaks in several African countries. Scientists have no idea where the Ebola virus originated. They believe EVD is animal-borne, with bats or non-human primates being the most likely source based on similar viruses. Infected animals can spread the virus to other animals such as apes, monkeys, duikers, and humans. Despite advances in science and technology, we have yet to develop an effective vaccine against the Ebola virus. Until now, more than 11,000 people have died as a result of this virus. Coronavirus or COVID-19. The novel human coronavirus disease 2019 was first reported in Wuhan, China, and has since spread worldwide to become the fifth documented pandemic since the 1918 influenza pandemic. By September 2021, nearly 2 years after COVID-19 was discovered, there had been over 200 million confirmed cases and over 4.6 million deaths from the disease. We take an in-depth look at the history of COVID-19, from the first recorded case to current efforts to stop the disease's spread through global vaccination programs. The first official cases of COVID-19 were reported on December 31, 2019, when the World Health Organization was notified of cases of pneumonia with no known cause in Wuhan, China. The Chinese authorities identified a novel coronavirus as the cause of those cases on January 7. After several weeks, the WHO declared the rapidly spreading COVID-19 outbreak a public health emergency of international concern on January 30, 2020. However, It wasn't until the following month, on February 11, that the novel coronavirus received its official name, COVID-19. The U.S. Centers for Disease Control and Prevention confirmed the first COVID-19 death in the country 9 days later. The man was in his 50s and lived in Washington state. By this time, the situation in Wuhan had stabilized following the implementation of unprecedented measures to contain the virus. China was reporting thousands of new cases per day at the start of the outbreak, which had dropped to dozens by March. In Europe, on the other hand, cases were increasing at an alarming rate, with Italy recording an unprecedented 250 deaths in the 24 hours between March 12 and March 13. As a result, on March 13, the WHO declared that Europe had become the pandemic's epicenter. The United States declared a state of emergency the same day. Finally, on December 31, 2020, the WHO issued its first emergency use validation for a COVID-19 vaccine, making the Pfizer and BioNTech vaccine the first to be used. The emergency validation was viewed as a positive step toward making COVID-19 vaccines available globally, which is required to end the pandemic. Thanks, viewers, for your positive feedback and comments for our channel. That's all for now. Please subscribe to our channel and press the bell button to receive notifications about new videos.